Quick note. This is an automated educational summary of public medical sources, Mayo Clinic, the NIH, and MedlinePlus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. Here's something worth knowing. According to the NIH Office of Dietary Supplements, vitamin B12 deficiency is more common than most people realize, especially in adults over 50, vegetarians, and anyone on long-term acid-reducing medication. And here's the catch Mayo Clinic emphasizes. You can eat plenty of B12 and still be deficient, because the real issue is often absorption, not intake. This video is a research roundup, not medical advice. We're going to walk through what Mayo Clinic, the NIH, MedlinePlus, the Cleveland Clinic, and the CDC say about the signs, the lab tests, and what to bring to your doctor. MedlinePlus explains the absorption process clearly. B12 from food binds to a protein called intrinsic factor produced in your stomach, then gets absorbed in the lower, small intestine. According to the Cleveland Clinic, anything that disrupts this chain can cause deficiency, even with a perfect diet. That includes pernicious anemia, which is an autoimmune attack on intrinsic factor, atrophic gastritis common in older adults, gastric bypass surgery, Crohn's disease, celiac disease, and long-term use of proton pump inhibitors, or metformin. The NIH notes that roughly 6% of adults under 60 and nearly 20% over 60 may have low or marginal B12 status. Mayo Clinic and MedlinePlus both flag neurological symptoms as the signs most people miss. Research from Mayo Clinic suggests early warning signs include tingling or numbness in the hands and feet, a sensation often described as pins and needles, balance problems, and difficulty walking on uneven surfaces. The NIH adds memory issues, confusion, and what patients commonly describe as brain fog. The Cleveland Clinic notes that left unaddressed, nerve damage from B12 deficiency can become permanent, which is why these symptoms shouldn't be brushed off, even when blood counts look normal. These signs warrant a conversation with a clinician, not self-treatment. The more familiar signs come from B12's role in red blood cell production. According to Mayo Clinic, deficiency can cause megaloblastic anemia, where red blood cells become unusually large and ineffective at carrying oxygen. The symptoms MedlinePlus lists include persistent fatigue, weakness, shortness of breath during light activity, pale or yellowish skin, a smooth and sore tongue, and heart palpitations. The NIH also notes mood changes, including depression and irritability, that can predate the physical symptoms. None of these signs are exclusive to B12, which is exactly why testing matters more than guessing. Here's where it gets useful. According to MedlinePlus, the first-line test is a serum vitamin B12 blood test, with the typical reference range listed as roughly 200 to 900 picograms per milliliter, though labs vary. The NIH and Mayo Clinic both note that serum B12 alone can miss early or functional deficiency. So two follow-up markers are often added: methylmalonic acid, known as MMA, and homocysteine. Both rise when cells aren't getting enough usable B12. The Cleveland Clinic adds intrinsic factor antibody testing when pernicious anemia is suspected. Bring this list to your doctor as discussion points. The CDC and NIH highlight specific groups with higher absorption risk. That includes adults over 60 due to declining stomach acid, people following strict vegan or vegetarian diets since B12 occurs naturally only in animal products, anyone who has had gastric or intestinal surgery, people with autoimmune conditions like pernicious anemia or Hashimoto's, long-term users of metformin or proton pump inhibitors such as omeprazole, and pregnant or breastfeeding individuals on plant-based diets. MedlinePlus suggests these groups discuss periodic screening with their primary care provider, since early detection is far easier to address than nerve damage that has already set in. Here's a nuance Mayo Clinic and the NIH both stress. A serum B12 result in the so-called normal range doesn't automatically rule deficiency out. Research suggests results in the gray zone, roughly 200 to 300 picograms per milliliter, can still reflect functional deficiency, especially when MMA or homocysteine are elevated. The Cleveland Clinic notes that symptoms plus borderline labs are worth a deeper look, not a dismissal. This is why a single number rarely tells the full story, and why these markers are something to interpret with a clinician who knows your history, medications, and diet. On the dietary side, the NIH lists the richest natural B12 sources as clams, beef liver, fish like salmon and tuna, eggs, dairy, and fortified cereals or nutritional yeast for plant-based eaters. MedlinePlus notes that B12 from supplements and fortified foods is often absorbed more efficiently than B12 bound to animal protein, which is why fortified options are commonly recommended for older adults. The CDC reminds readers that food choices support but don't replace medical evaluation when symptoms are present. Any supplementation strategy, including high-dose or injection protocols, is a clinician's call, not a YouTube call. If anything in this video sounds familiar, here's what the major institutions suggest you walk in with. A symptom log including any tingling, fatigue, or memory changes and when they started. A complete medication list, since metformin, PPIs, and H2 blockers all affect B12 absorption per the NIH. A dietary snapshot covering the last 6 months. And a written request for the 3 labs MedlinePlus and Mayo Clinic describe serum B12, methylmalonic acid, and homocysteine. That preparation turns a 5-minute appointment into a useful one. Your clinician decides what testing and treatment, if any, makes sense.